My name is Akel. I'm an interventional cardiologist. This morning we're in Cardiovascular Institute of Trinity, and we're talking about the Shimadzu Trinias Cardiovascular Lab. One of the main features that I really like about this system is the quality of the fluoroscopy. We have been able to get very good definition of the position of the stent, the expansion of the stent. In addition, a lot of our patients have calcific disease, so we're able to easily identify the outline of the vessel where there's calcification, identify the calcific plaque. This is not only helpful in trying to get the diagnosis for these patients, it's also helpful in planning therapy and being able to achieve success for these cases. Some of the we're addressing more and more complex below-knee disease with chronic total occlusions, and oftentimes the outline of the vessels is easily visible with this with this equipment, when it used to be a challenge with some of the other vendors that we've used. One of the features that I really like as well is the RSM bolus chase. A lot of our patients will move their legs either consciously or subconsciously as the dye kind of hits the lower part of the leg and they feel the burning from it. We are doing our cases under conscious sedation, so the patients are not completely out. These images are still usable with RSM bolus chase, whereas with the typical subtraction angiography bolus chase, it's going to be a very difficult and taxing procedure to be able to fix these images and have them be usable. After we kind of get the lay of the land with the RSM bolus chase, we kind of come back and do subtraction images specifically on areas that are of concern, and I found that to be a very helpful feature. Another feature that is we find very helpful is particularly during radial heart catheterization, is the ability of the II to move horizontally. Most of the cases we're able to advance our catheters up to the subclavian area without any difficulty, but about 10 to 15% of patients will have some tortuosity or some anatomic challenges within the arm. Visualizing this arm used to be and still is a big production with some of the other vendors, where the whole II have to be manually rotated, and then sometimes you have to move the patient's arm to be able to visualize, and always visualization is suboptimal. It is completely seamless with the system, where we're able to move the II, get a very crisp picture, and facilitate the flow of the case. One of the other features that I really like about this system is the ability to horizontally move the detector. We're doing more and more of our cases, almost all of our coronary interventions, our coronary diagnostics are done through the radial axis. Vast majority of the patients, about 90% of the times, we're able to make it up to the heart without difficulty. Some 10 to 50% of patients will have anatomic challenges that will require visualization of the arm. We are able to move the detector horizontally and able to visualize all the way down to the fingertips on either side, whether it's the left or the right side. This used to be a big production when we're using, and we're still using, other manufacturers in other places, where we have to manually move the bed to be able and sometimes the patient's arm to be able to visualize it. This has been something that we found very helpful in this system. So during the case that we did today, I hope we were able to show you the high quality of the fluoroscopy and how it came really handy in this case. The retained segment of the stent happened to be right below the area of disease. So, and this used to be something that is not as easily visualized with other vendor equipment. With this particular system, we have very, very crisp definition of this area of fluoroscopy, which has got a very important application on how we treat these patients and help us serve our patients better and be more successful doing it. part of it is the high quality of fluoroscopy, and the other part is the large size of the screen and the versatility of the screen. We could fairly easily change the arrangement of different items on it. We have pressure right in front of us. We have the prior images from prior procedure easily pulled in front of us as well. So all these are things that are helpful in providing the best care that we can for our patients.